You ready? Let's do this. Hello, everyone. Welcome back to the GROklahoma podcast, where we explore groundbreaking research and innovative approaches to improving health outcomes across Oklahoma and beyond. Today, I'm thrilled to be joined by Regents professor and associate professor in the College of Nursing Biobehavioral Sciences Department at the University of Oklahoma Health Sciences. She's also the track coordinator for the Adult-Gerontology Clinical Nurse Specialist CNS program, where she has dedicated herself to shaping the next generation of nursing professionals. With over a decade of involvement in clinical and translational research, she brings a lot of expertise into interdisciplinary collaboration, health equity, and addressing the needs of the rural and underserved communities in Oklahoma. Her work has significantly contributed to advancing nursing education and promoting equity in healthcare delivery. Today, we'll talk about her experiences, the challenges and opportunities in nursing research, and how the College of Nursing is working to bridge gaps in health disparities. And so please, everyone, join me in welcoming Dr. Susan Dresser to the podcast. And I have a twist for you. Not only are we joined by Dr. Dresser, we also have three of our exceptional students, Cody Bynum, Meagan Wright, and Debra Hawkins. They're all pursuing a doctorate of nursing practice degree in the Adult-Gerontology Clinical Nursing Specialist pathway, and the recipients of the prestigious HRSA grants, and each of them bring their unique experiences and perspectives to our discussion today on especially advancing healthcare for underserved population. Thank you all so much and welcome to the podcast.
Thank you for having us. It's a pleasure to be here.
Thank you. So let's start with you, Dr. Dresser. I guess one of the questions I'm always curious to know about the foundational stories as well, because I imagine if we were to draw a thread or a string across how you grew up and where you're right now, being able to tell us a little bit about your background and, if any, what early experiences will have predicted your path to what you're currently doing right now in nursing.
Oh, well, thank you. So my path has been, I think it's been fairly straightforward. However, I didn't enter academia until very late in life. I worked in practice in acute care hospitals. My background has always been critical care with focus on cardiovascular nursing and cardiovascular medicine. And in Oklahoma, that is just like the nation. Cardiovascular healthcare is a tremendous need. Cardiovascular disease is so prevalent. But I worked in practice for all of my career and then entered academia after I started my PhD. So I really started a new chapter and became a novice again when I started teaching in higher education. And in the last 10 years, since I've been with the Fran and Earl Ziegler College of Nursing at the University of Oklahoma Health Sciences, I have thoroughly enjoyed working both with the students and beginning to carve out my research trajectory and then to become involved in this HRSA grant. Even though my work has always been in the acute care setting, over time I've begun to see the tremendous need and opportunities for improving health beyond and before patients arrive at the hospital. So I've really seen a broader spectrum of how we as nurses and as clinical nurse specialists can impact overall health of populations. And this grant is just one example of how we can achieve that.
Oh, that's awesome. Thanks for sharing that. Can you tell us where you grew up? Were you born and bred in Oklahoma?
No. Actually, I was born in Miami, Florida.
Oh, wow.
So I guess I'm actually a Floridian, but I grew up in North Carolina. I grew up in Charlotte, North Carolina. I moved around a little bit in between there. My father was an airline mechanic, and so we kind of moved for him, not like the military, but we did move. And we ended up in Charlotte, where I was from the time I was 8. And I went to Duke University School of Nursing because I was a nurse at Duke. And fortunately, they had a program where they paid for my tuition. So that was no small amount. And I really thought I would end up living in North Carolina and working in advanced practice. However, my husband had different ideas and a different career trajectory, and that brought us to Oklahoma, which has been a wonderful place to raise 3 children.
Okay, so wow, Florida to North Carolina. And so how long have you been in Oklahoma? For the past 10 years, thereabouts?
Oh gosh, we moved here in 1989,
Oh, okay,
and
okay.
I finished my master's degree after we moved here. I was in the process of finishing that, and was pregnant with our third child, and
Okay.
yeah, so been
Okay.
here a long time.
Now, as a child, looking back now, was there anything that could have maybe predicted your path in nursing?
So I think everything that interests me now grew out of my time at the bedside.
Oh, yeah.
Even though I never ever thought I would be in research, I thought it was dull and boring. I didn't want a life like that. But there really is something that happens when you're in practice, when you're
Yeah.
right at the sharp edge of what's happening in healthcare. You see the gaps, you
Yeah.
see the process breakdowns, and that's what I observed in my time of working in critical care. I saw things that I couldn't explain and wanted to know the answers and couldn't find the answers when I went to the literature and
Mm.
thought, well, somebody needs to look at these things. And
Yeah.
so that's kind of how I backed into getting a PhD. I
Wow.
never thought I would do it, just backed into it, sort of. Yeah.
Real quick before I move on to Cody, you said something about you had a late start in life when it came to nursing, and I think that's very key for those who might be listening and coping with, oh, this is too late for me to start this journey. Are there some words of wisdom you like to recycle?
Oh,
As
yes. Yes. So when I started my PhD, I had two kids in college.
oh,
My third one was already finished. I had two in college, and then I tossed this idea around for about 4 years, thinking, do I really want to do it? Because it did not it didn't increase my income. It just really took me to a whole different direction by getting a PhD, which has been a great opportunity. And I would say you're never too old. I loved
mm,
every minute of my doctoral program. For me, I was going in and being recreated and molded almost into something different, and I loved it. I loved that. I loved everything about the hard work of it. But so I would say just do it. I hear people in their 30s and 40s say, "I don't know, I'm a little too old." Like, oh no,
yeah,
no, 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 no,
yeah,
not at
yeah.
all.
All right. Thank you so much. And hello, Cody.
Hi.
By the way, first of all, thank you for your service. So you have a Bachelor's of Science in Biology and also a Bachelor's of Science degree in nursing. And you're also a former Army Special Service member. And you've done some work in patient-centered care. Can you just tell us a little bit more about you, especially your path towards nursing?
Yes. So I am originally from a small town in northeast Oklahoma. It's called Grove, Oklahoma, near Grand Lake. And I always have, since I was very little, I've always been interested in healthcare, just because my mother worked in a doctor's office, and they really brought me to the forefront of like medical care and like treating patients with dignity and respect, especially in that capacity in the medical office. So it brought me towards healthcare, but when I was going through my undergrad, I didn't know what aspect of healthcare I wanted to do. But I finally settled on nursing, and I've enjoyed my decision so far. I went from a combat medic in the Army for a couple of years, retired due to injury, went and finished my degree in biology in 2024, or not 2022, apologies. And then 2024, I finished my bachelor's in nursing. So that leads me to being a nurse now,
Oh,
and then
nice.
going into the doctorate role.
Yeah, yeah. So how's the doctoral program going? And I imagine it's so vastly different from your experience in serving in the U.S. Army.
It's completely different for sure. Um, it would be a lot more time management based, balancing like personal life with work and the program itself. I was fortunate enough during being an undergrad that I didn't really have to work, so I could focus purely on academics. But during just personal situations, I've had to work a little bit during the doctoral program. So having the HRSA grant has really helped me focus more specifically on the academic sides of things. So it's just been really helpful.
Thanks so much for sharing that. And Megan, um, Nice to meet you. Thank you so much for being on the
Hi, thanks for having
podcast.
me.
Yeah, yeah. So you also are pursuing a DNP program here. You have a master's in public health in addition to an MBA on or business, sorry, a BA and a BSN. Oh wow. You have been studying a lot. So I'm curious to know just a little bit about you and where you have your passion also lies in serving rural communities as an advanced practice nurse. Maybe just tell us a little bit about your foundational story and what you hope to get out of your DMP to help with that life goal of yours of serving rural communities.
I still live in the same county that I grew up in, graduated high school, and I've never left. And I love these people in my community. I graduated high school in May of 2014, and then that following July, my grandpa was in a tractor accident. Both of my grandparents are very rural farmers. And he spent the next 4 months in an ICU. And this was right after I graduated high school. I wasn't quite sure what I wanted to do. And being at his bedside, watching the nurses and the providers care for him really sparked my interest in a healthcare career. So then I went on to RSU to obtain a degree in nursing. I was in St. Francis for about a year. I was a nurse there when I was a new grad nurse in Tulsa. It was a great place to get a foundation for nursing under my belt. And then after that first year, I got a job at the hospital here in my hometown of Pryor, and I've been with this hospital since 2020.
Oh, wow. Yeah, I was going to ask you the name of but it's already mentioned in Pryor. And I can't help but contrast your story with Cody's, like a family member and seeing how the nurses, took care of them and nursed them to health was what really formed your passion towards nursing. And I imagine now people watching you and, other nurses like you practicing and how that can also shape their future goals. So it's funny how we're very connected. Thanks for sharing that story. And I've heard it said so many
Yeah.
times about nurses being the heartbeat of the healthcare profession. And yeah, so thanks for sharing that. And last but definitely
Thank
not the
you.
least is Debra. So Debra, you're an experienced emergency ER nurse with over 10 years of expertise. And you're a two-time HRSA grant recipient. Congratulations on that. And then you also have a lot of passion in leadership and you've had a long-standing involvement in community service. And with your recent recognition as the Girl Scout Leader of the Year for Western Oklahoma, well decorated. Thank you for coming on the podcast and tell us a little bit more about you, especially where you grew up and what forged your path towards nursing.
Well, I can tell you I grew up a little bit everywhere. Both my parents were Marines, so I had wonderful opportunities to do a lot of traveling as a child. Our longest stint was in Japan, which was just an enriching experience. I know even from very young ages, there's lots of pictures of me. I wanted to be a doctor, wearing the gowns and everything and all the toys and stuff you get with that kind of
Yeah.
thing. Now, surprisingly enough, when I went to Northern Oklahoma College, was my first junior college, it wasn't anything medical that I went into. I had been watching CSI and I thought, I'm going to be a forensic specialist. And so I started to pursue that. And I actually ended up with a bachelor's from Northwestern Oklahoma State University in sociology. So, I was kind of all over the place. I was very young and, just exploring different things. And then I went into banking for a while. And then I went to LPN school at Autry Tech in Enid. And so I kind of ended up in the place where from a very young age that I always kind of wanted to be in the medical field. But I had a little bit longer of a path. So I was a little bit older when I went back to school to become an LPN. And I was an LPN for 7 years. And during that time, I did home health and hospice, always working in rural areas, working full time, raising a family, doing Girl Scouts, so extracurricular activities. Yeah. And then I went to RN school at Northern Oklahoma College. I did get my bachelor's at Northwestern Oklahoma State University. So kind of went back and forth to those same schools that I started with. And really what drove me to get my bachelor's was I found that even just to get my RN was at an LPN level, I would keep hitting a roadblock. I wanted to be in leadership. I wanted to keep going. And then you get to those positions where you have to be an RN. So I went back to school, got my RN, got my BSN. I was then a house service administrator for 5 years in the correctional system,
Oh, wow.
which is very enlightening to underserved populations. That's, corrections is just where a lot of our underserved patients are for various reasons. They end up in the correctional system. So it was a wonderful display of, how people's upbringing, how their knowledge, their socioeconomics can put them in situations where their health is the last thing that they're thinking about. They're trying to put food on the table, or they have fines to pay. And so the last thing they're going to do is go to the doctor or get medication. So that was a really big exposure to the need to improve our correctional system, our mental health system. And so I decided that I wanted to go to school to be an APRN. And I didn't just want to be an APRN. I wanted to be a clinical nurse specialist. They have 3 spheres. We do direct patient care, nursing practice, and systems. So we're going to be hitting it from all kinds of directions. We could do research on how to make things better. We can also be an educator on educating other nurses to be able to be more caring and more understanding of underserved populations, or we could be clinicians ourselves in specialties with populations. So that really kind of drove me to know that, hey, if I can get this, and maybe I can start making a difference in our correctional system, in our mental health system, with rural communities, with underserved. I do live in a very small town, Tonopah, Oklahoma. As a military person, we moved so much. So it was difficult to make connections. So when we came here at the age of 14, and I was just embraced by the small town life and how, it's like they've known you forever. And suddenly you have a giant group of friends, and even as an adult, I did move a little bit and traveled a little bit within Oklahoma, but I ended up coming right back to the town that I went to high school in to raise my family in that type of smaller town environment. And I do plan to stay in the rural system when I become a provider, which should be in May of 2025.
What a life. And you've well-read, well-lived, and well-traveled as well. Thanks for sharing that. So before we spend, the bulk of our conversation is going to focus on our HRSA grants, but I'm curious to know, since most of all of your work is, and just you also live with the community. So I know for you, Debra and Meagan, you have rural connections, especially Meagan. What would you say overall for all four of you? What makes Oklahoma unique in addressing these health disparities and healthcare needs, especially the focus on rural health? I can start with Susan, and then we can popcorn to Debra, Meagan, and then Cody.
Sure. So in preparation for the grant, of course, we had to provide a lot of statistics and data to support the need for this program and these funds in the state of Oklahoma. And so in doing that, I was surprised. I knew Oklahoma had a lot of rural areas, but I really didn't understand at the time 77 counties we have in Oklahoma, and 71 of those are considered rural. Yes. So it's definitely, the need is great here.
Yeah, I think the threshold is 7%, but Oklahoma has 14% of the threshold for federally designated rural areas. Right.
Yeah, more than 33% of our Oklahomans live in rural communities. And, when you live in a rural community, you're more likely to rely on advanced practice nurses for your primary health care needs, your mental health care needs. And this, we also have the second lowest physician to resident ratio in the United States. We're 45th in overall health rankings, and we're 45th, 48th, and so many more. So the need is just tremendous here.
Before I have the next person respond to this, you hit on a point that I think we can elaborate for our listeners: APRNs, right?
Yes.
So
right.
Maybe just expand a little bit about their unique role, especially in meeting those needs in rural communities.
Sure. Yeah, sure. So this grant specified that they wanted to award the grants to students who were studying to become advanced practice nurses, either as family nurse practitioners, adult gerontology, clinical nurse specialists, psych mental health practitioners, or women's health. And at the Fran and Earl Ziegler College of Nursing, we offer 3 of those programs. We offer the psych mental health, the family nurse practitioner, and adult gero CNS. So those are 3 different advanced practice nursing roles. And we work all differently. Obviously, we work with different patient populations, but like Debra alluded to, the clinical nurse specialist is unique in that we provide not only direct patient care like you would imagine a nurse practitioner doing, we provide one-on-one direct care in hospitals, in outpatient facilities, but we also look at a more broad perspective of how to improve the care of the populations that we're specializing in. And so we look at those systems issues, at the processes that are in place. Where do things break down across transitions of care? We dig down into those areas. So, and then the third area that we work in is the nursing practice. And that means we work to build and develop the expertise of nurses that are caring for the patients in the population that we specialize in. So we kind of float back and forth across those 3 spheres, taking a broader look at how do you improve population health? You don't do it just by providing one-on-one patient care. Yeah. So that's how the CNS, or the clinical nurse specialist, is unique.
Got it. Thank you. That's very, very expansive. I really enjoyed hearing you talk about that. Debra, is there anything you'd like to add?
Well, I think that it's just, we are 47th for healthcare access, which is actually up from 49th, which Yay. I don't think any of us are going to be.
I'm always saying, how's Mississippi doing? That's always my question. How's Mississippi doing?
So, still a little disappointing, 47% out of 50. So, but you also have to look at the other statistics of Oklahoma. We have a high obesity rate, 42%, 20% of our children still face hunger on a regular basis. Smoking prevalence is high at 19%. We also have a high uninsured rate at about 14%. So you start to think of, you start to paint this picture of what rural Oklahoma looks like. And yes, a lot of these people are also in urban areas. But the problem is because we have such few physicians spread out, such few APRNs spread out across these rural areas, is there's even less knowledge about, how we should eat, how we should be taking care of ourselves. Diabetes is on the rise, of course, with the obesity. So who's teaching everyone? We keep wanting to improve on our rate of 47 in critical access, but and some of that is legislation, of course, convincing legislation that we need more APRNs. They need to have the ability to be able to reach these other communities and maybe not necessarily have as much supervision needs and restrictions, because we do need to get out there more. The great thing about the grant is the finances, it's $2.5 million, which was awarded in 2023 to the Fran and Earl Ziegler College of Nursing. And the focus is really on APRNs, training for rural, tribal, and underserved areas. So a lot of people wonder what exactly is underserved populations. Well, we've got our veterans, which are underserved, and it's very disappointing that we have underserved veterans. But we have our disabled, we have our minority populations, and when you think of people that are in that minority group, it's a much larger group than what people think. Socioeconomics alone kind of puts you in that underserved population. When our median income is $58,000 in Oklahoma, I'm sure a lot of us think back to those days when, how did we survive on that in our younger years? We're lucky to be nurses because we make pretty decent money. But the idea of when you have families come in that can't afford medications because their income is $60,000 and they're simply putting a roof over their head, and then you're asking them to buy fruits and vegetables, which are very expensive. So you have to look for little wins. If your patient comes in and they say, hey, I'm no longer smoking 3 packs a day. I'm only smoking 1 pack a day. Sure, we would love it if they'd quit smoking, but you know what? They did reduce it. So they are learning, they are changing their behavior. So I think the big thing about rural Oklahoma is we have to rethink how to get through to the people that we serve. We have to be careful about the language we use, making sure that we're speaking in a way that they can understand, not using big terms, not assuming that they understand what we mean, and making sure that we rephrase. So I think the big thing about rural Oklahoma is that, we do need that extra instruction on looking at our population that we're serving and how it is like a totally different world when you're comparing it to urban Oklahoma. So the HRSA grant really gives us the opportunity to do that. It does a lot of education about the diversity that we experience in our workforce, being culturally aware, and just making sure that we understand social determinations in health.
Got it.
We talk about rural, as Debra was just saying, but through our grant, we also identified the incarcerated people as underserved. And surprisingly, Oklahoma was, at the time we submitted the grant, had the highest incarceration rate in the world.
Really?
In the
More
world.
than California and New York?
Yes.
Wow.
Yes. So we're the highest in the state, in the United States.
Yeah.
We're higher. Yes. So I don't know what to attribute that to, but yes. And, when you're incarcerated, there are many barriers to healthcare. You have lack of physical exercise, high rates of mental health disorders.
Mm-hmm.
Yeah. Eating unhealthy, high processed foods, substance abuse disorders. So we identified this as an underserved population with multiple social determinants of health. And so part of our experience that we expose our students to are clinical experiences in departments of corrections. And Debra can speak to that as well. But so it really has allowed us to reach out and expose our students to opportunities where they might really want to focus after they graduate.
Wow. As a nurse, I'm sure you hear a lot about bedside to benchside, but you guys are taking it beyond that to the streets, literally, and addressing those complicated health issues. This next question, I'll start with Meagan and Cody, and then maybe have Debra finish it up. But to get that question started, I think it would be nice to give a little bit of an overview about the HRSA grant. So the HRSA, or the Health Resources and Service Administration grant, is a federally funded program under the U.S. Department of Health and Human Services, and it aims to improve health outcomes and reduce disparities by supporting innovative healthcare initiatives. Also, I think it does workforce development, community-based programs. And maybe start by telling us the scope of your grant and what it means to you in your educational journey right now to be a grantee for this award.
I guess I'll start out. So really the HRSA grant is a great opportunity. It not only provides funds for education like tuition and fees and things along the lines of that, but it also gives a really good opportunity to actually spend a good portion of your clinical rounds or clinical hours in these underserved areas. By working with different individuals that within the grant itself, there's a lot of good networking opportunities that present themselves. So the HRSA grant itself and the people that are running it are really good at finding different underserved communities that you can spend your hours in. And I think it can open up a really expansive method of like something that you could find really interesting in and focus your career in as a whole.
Thank you so much. I love that aspect of, the clinical hours. Like whatever you're maybe teasing out during the research, you're able to go back and forth within the community you practice to explore, additional topics of interest. I think that's very, very neat. Meagan, how about you?
The grant obviously has been a great relief of financial burden to pay for my first year into this program. And besides that, it has also helped to hone in on my love for serving the rural population of Oklahoma. We have these modules that the staff of the grant has created for us to work through online through Canvas. And I was working through some of them this past week, and there's just a lot of great resources there. When I first applied for the HRSA grant, I was mostly interested in the Native American population. I am a Cherokee citizen myself, and I utilize the Cherokee Nation healthcare. And so I do have a passion for that and for the population of individuals. But once I was working through the modules and was able to also learn about the different populations of the rural communities that need help, it just gave me a better understanding of how many rural populations do need better healthcare in Oklahoma.
Thank you so much. Thanks for sharing that. And Debra, real quick, what does it mean for you to be a grantee of this award?
So I think what the big thing for me with the award is, so being a military kid, we don't, I'll be honest with you, I was very naive to a lot of other, like you get to travel, but you don't necessarily see some of the discriminations that you see because, we're more, as kids, we're more worried about, are you an Army kid? Are you getting called a jarhead or something as a child being a Marine kiddo. So when we did finally settle down in the States in Oklahoma, was really the first time that I kind of experienced what it was like when people kind of didn't like other populations and things like that. So I think I've always kind of been in that area of naive, even growing up. And so the great thing about the grant is it really kind of brought more perspective to some of the ways that as healthcare providers, we may have ethical dilemmas. We also may have our own biases that we don't even realize that we have and that we're projecting in on people. So I think it's important. That's one big aspect of the grant is that it makes you more aware of the different diversities. And for me, I really wasn't exposed a lot to that, to really understanding people with different sexual orientations, the kind of special needs that they have, the cultural aspects. I thought that I was culturally versed from my teaching as a nurse. And I realized that really that it just barely touches the surface. Jehovah's Witnesses can have blood, that. That eye contact with some cultures is not appropriate and you learn the basics. But this grant has been wonderful about really kind of diving more into the things that we don't realize as practitioners so that we can actually start to serve our populations much better by understanding people and the reason they're in the socioeconomics that they are and some of their cultural beliefs.
For that. I mean, I agree with you. I think everyone needs to, but if you're working with people that is, especially in healthcare, taking a stock of your own biases, both implicit and otherwise, and see how that interacts with how how it affects how you interact with people. I think denying our biases is what has gotten us in the pickle because we all have biases. And I love how you acknowledge, the upbringing you had and how you being exposed to this line of work right now has really changed your perspective on so many things. But it's also that vulnerability in knowing that, wow, this is real life and it's so vastly different from how I grew up, but I'm able to learn and work with this community because my interest is in serving them and serving their needs. So thanks for that reminder, Debra. Susan, can you tell us a little bit more about the project as far as, the overall goal, how much it's funded for, how long you have it for, and just the grantsmanship?
Yes, I'd love to.
Because I imagine that was a huge task, taking that on.
Oh, yeah, it was tremendous. But before I answer that, I just wanted to ping off of something Debra said.
Okay.
In identifying the populations that we considered rural and underserved, one of the groups that we identified were the LGBTQIA plus population. And at the time we submitted this grant in 2023, the legislative session in that year introduced 40 bills that limited LGBTQ Oklahomans' access to health care and options for self-expression. And overcoming barriers to equitable health care is one of the goals that we have for educating our APRN students. So this is a population we identified, and we have 2 clinics that focus on the care of the LGBTQIA population and their families. So that's another opportunity that students probably would not have had we not received this grant and then secured a partnership to do our clinical rotations there. But in answer to your question about the grant, yes, writing a grant is no easy task.
How much for a HRSA
As I'm
grant?
sure.
Yeah.
Yes, this is a huge grant. It's
Yeah.
just a little over $2.5 million that we received, but it was a
Amazing.
team effort from multiple people at the college, as well as someone from out of state that had been very successful in obtaining HRSA grants. It was fast and furious, multiple components that then all came together in a very short time. We saw the need. We felt like the need was there. It was obvious. It was just dependent on our ability to demonstrate that need, to put it all together in a package that was compelling, to show that we had the ability to prepare the students and to offer them these wonderful clinical opportunities with federally qualified health centers and the Native American Indian population. So we knew that we had a great opportunity to make a difference in the state. It was just a matter of working very hard, burning the midnight oil, and putting this pen to paper and getting it done. So we think we deserved it, but it also is no small feat to write a grant.
It's not, and congrats on all of that.
Thank you.
Yeah, it's very, very impressive and encouraging. All right. So I guess my next question for you, Susan, and we can have the other students also talk about that, will be so about the College of Nursing, right? And by extension, you're all part of it. In addition to this HRSA grant, what are additional initiatives or programs that are currently underway to meet the needs of rural and underserved Oklahomans? So basically, how do you see the efforts of the college in addressing those needs? Yeah.
So as we've expanded our clinical partnerships with new affiliation agreements with some of the facilities that I've just spoken to, that's one way. And it's by having those facility agreements across the state, we've now opened the door for other students who are not recipients of the grant to also do clinical experiences and rotations in very different and unique experiences. So that's one way. We've increased the number. We've been able to increase the number of students we admit to our program because now they can afford the program if they're a recipient of the grant.
Yeah.
We've also we're building, I can't say that it's been approved yet because it hasn't gone as far as the Board of Regents, but we're building a women's health nurse practitioner program because the statistics around women's health and maternal mortality are pretty dismal in the state of Oklahoma. So that's a program that is in direct response to the needs of Oklahomans. And then, of course, we have our psych mental health program, which is in response to tremendous psych and mental health needs across the state.
Thank you for that. That's really, really nice to hear about those additional efforts. Anyone else wants to add to that? You don't have to answer, by the way.
I think it's important to also bring to the forefront that the College of Nursing has also increased its undergrad RN program by a multitude. So the past few years, they've been accepting pretty much any applicant that is eligible and fits their specific criteria, which increases the amount of registered nurses in the state of Oklahoma itself. So I think that really helps with decreasing the disparities across Oklahoma because there always is a nursing shortage. So I think that really helps kind of put it in the right direction.
Thank you for that. I had another question. I'll start with Susan, and then I'll have an offshoot one for the students. So as you're talking, Susan, I couldn't even help but draw that parallel between you and James Mould, who I had on the podcast a while back. He's he's now retired, but he used to be part of the, I think he's still currently part of the APRN, and the Geriatric Education Center was actually named after him. Have you had any collaborations with him at all?
I have not.
Really?
I have had collaboration. No, I haven't, unfortunately. Tell me, what was his name again?
Oh, James Mold. Yeah, he's at primary family and community medicine at OUHSC. Yeah, Jim. They call him Jim, but he's James Mold, and he finished from Duke University as well. And
Oh,
he
gosh,
yes,
gosh,
yes,
gosh.
yes. He established the
Yes.
Oklahoma Primary Healthcare Improvement Cooperative. So what you do with the
Hmm.
APRN, he's also very passionate about primary care doctors meeting the needs of rural health and especially the aging. Because I know you do adult
Right.
gerontology. Yeah, it was just an offshoot
No,
question.
I'm just beginning to do some work with the geriatric center around the concept of frailty,
Wow.
and trying to tie frailty in with some of our underserved populations. See where that intersection is and what we can do. But no, I haven't had the opportunity of working with him. I'd like to look that up and follow
Yeah, you
through
should
on it.
check. You should check in on it. Check in on it. So this question is for all of you, but I'll start with Susan first. Um, Given the large scale of this grant, I imagine it's also not just multidisciplinary, but you also have complementary skill sets that were, represented on the grant. What are some of the tips in collaborating across disciplines, especially for team building and ensuring that the work gets done without, it being, without lagging behind? Because you also have to make sure you're meeting the requirements of the funder. And for the students will be, what are some of the skills in addition to the clinical and the research skills? What are some of the additional soft skills you're learning from being part of this grant that you like to take with you in the future?
What a great question. So I will start. One thing that we didn't speak to is that all of our students at the undergraduate and graduate level are highly encouraged and sometimes required as part of their coursework to participate in interprofessional education
Nice.
offerings where they work across different programs at the Health Sciences Center, but also to work and obtain clinical hours working in one of our Unity Health clinics, which are student run, and they are for the underserved population. So many of our students have experiences working with underserved populations and doing collaborative work with the College of Medicine and Dentistry and Allied Health. In terms of working collaboratively, that is one of the things that the clinical nurse specialist really excels at. I mean, we look at systems problems, and that entails working with other disciplines to solve even what we would consider to be the smallest issue in the smallest micro system. Requires a village to fix and takes multiple months, years to get to the bottom of and develop strategies and then monitor the outcomes. But that is something that our students in the CNS program really get a lot of exposure to. And I think that is one of the reasons that we're so suited to do the work of this grant. So I'll let some of the other folks answer.
Thank you for sharing that. Thank you. We can start with Megan and then Deborah and then Cody.
I've just began the program, and so Dr. Dresser might need a little help answering this one. I haven't really had an opportunity for an interdisciplinary type of opportunity or project.
Oh, you will.
Yes,
will.
I assume. Just I have not this semester thus far. I mean, in my field, that I work in, I see all different types of patients, and I work with many different types of providers.
Okay.
So I have had the opportunity to get the HRSA grant 2 years in a row, which has opened up several different interesting things. I have never been big on understanding our legislation process, but I've really gotten to dive into that because one of the big things is they push us to make sure that we're not just worried about our small little towns, our small little communities, but also understand the legislation that's going on that's going to affect our community, that's going to affect us as APRNs, us as clinical nurse specialists. So I got to be a nurse of the day up at the Capitol, which was a lot of fun, getting to see how the legislative process worked. We also get a stipend each month, and I actually use my stipend for different certificates. So I went and got my TNCC, my foot care certification, my certified bariatric counselor certification. So I try to use that money to expand my education in ways that I know that we need. So, for instance, I mentioned the fact of our very high obesity rate. So I thought it would be a good idea to kind of understand that population much better. So I got this little bit of extra education on the side. And really a lot of that is just that OU really promotes the keep your mind fresh, keep learning, never stop learning. Even when you graduate, make sure that you're staying up on the latest evidence-based practice. And that's a huge thing that clinical nurse specialists do, is we make sure that we're bringing evidence-based practice to the bedside. We're keeping up on policies, making sure that our policies are, with the trends, what's going on, what do we know now? So it's been a really great experience to kind of try new things, to be in an environment that really promotes education, promotes diversity, and just getting involved. Something that we also got to do was volunteer at a homeless shelter, which I volunteered at a smaller homeless shelter before, like just feeding soup and things like that, but never in a medical perspective. And the opportunity of getting to do that was, what do you do when your patient literally has absolutely no resources? They don't even have a roof over their head. And you're leaning over them, taking their blood pressure, talking to them about high blood pressure, and looking at these wounds on their feet, and they don't have clean socks to change into. They don't have dressings or a way to keep their wounds clean. So that was such an eye opener on, the disparity of people that have no resources whatsoever, and what are we doing to help this population? So I wish I had the answer to that, and I could just say, this is what we're doing, and this is how we're going to fix it. And right. I don't have that, but OU has really given us wonderful opportunities with the grant that I would not have gotten otherwise. I would not have gotten exposures to these different populations if I hadn't had their opportunity with the HRSA grant.
I'm sure on the communities you're serving, there will be an impact, but just think about the additional benefits, on your lives, as professionals, and the touch points you have across the way. And those are some of the things sometimes we don't capture when we get funded with grants. We look at, hard metrics like how many papers were funded, how many individuals did we enroll into the study, but there's some other soft important skills that you're gaining from it that is not translatable. And I'm glad we're able to capture that on the podcast. So thanks for that reminder, Debra. As we wind down now, I had your just some rounding up questions. So I will start with Cody on this one. So you've been in the program now for just a little bit of a while. What's one thing you would say? I think I can ask Cody and Meagan this. What's one thing you say you've learned about yourself during your DNP journey so far?
Well, I'd say the most important thing is just to give myself grace. I grew up as a perfectionist, so every little thing, if I did something incorrect, I would really be hard on myself. But something that this program really has helped me realize is that I just need to give myself grace and give myself the opportunity to learn, because I'm going to see stuff and hear stuff that is going to be beyond my current knowledge, but it's going to teach me those things. So just giving myself a little grace and just doing my best with what I'm given, because not everything is going to go exactly the way that you may plan. Yeah.
Thank you for that. And for you, Meagan, I think you have a particular twist because you're still currently living in the community you grew up in, and you described it as quite rural. I imagine sometimes you'll have your view, like the way you practice is probably going to be a lot different from how most people are going to practice, because you know a lot about these unique needs of the community. So what would you say has been the biggest lessons you've learned so far?
Before I began the program, just thinking about starting a doctorate program was extremely intimidating. And think since I live in this community still, I can probably speak on a lot of rural Americans when it comes to healthcare. It's easy to feel illiterate about healthcare. Like you don't really know everything, about it, and kind of dumb on certain subjects. And I even see that in my patients. I mean, they may have had a disease process for 30 years and they still don't know how to manage it. Yeah. And so just like a lot of healthcare illiteracy there. One thing I've learned about myself during this journey so far, I know that I can do this program. I had a bit of a rough start in one of my classes, just an assignment that came along that was very difficult. And I'm also, like Cody, a ridiculous perfectionist. And I did not receive the grade I wanted, but I was able to really hone in and work hard the rest of the semester. And I thankfully have ended the class with an A still, but it was a lot of hard work there. And I really think that, I can do this program. It's going to take a lot of hard work and dedication, but I know that I have that in me. And also, the hospital that I work at is we have 3 different departments. So we have outpatient, emergency medicine, and a med-surg floor. And I work all 3 departments. So very networked within the facility. And when I speak with different providers about, my plans and what I'm going to be doing, like I'm going back to school to receive my doctorate, they're all so encouraging. And they're just very encouraging. And they're like, oh, that's definitely something you should do. You're so smart. We can see you. And not to toot my own horn, but when I first started the program, I was just super intimidated. Like, I don't know if I can do this really, like a nurse practitioner. I'm just from a small town in Oklahoma. I literally work at a really small hospital. I don't have any big things about my life. And so just their encouragement that I received, from my fellow providers has been really amazing. And I've learned that I can do this program. It's just going to take much dedication and hours of hard work.
What a raw, honest perspective that was. Thanks for sharing that. And love how you were able to be very realistic as to some of the struggles you've had and how you're managing that. As someone who also suffers from perfectionism, always remember that your 50% could be someone else's 100%, okay? So don't be too hard on yourself. And I should remind myself that as well. How about for you? For Debra, I actually have this question for you and Susan. Given just how nursing education is evolving, right? What are some of the emerging trends or even innovations that you find particularly promising, especially in closing the gaps we see in health equities in our communities?
So I definitely think that the future is going to be more telehealth. In rural areas, bringing in those specialists is so difficult. So what I really love is that we are getting the exposure to see exactly how telehealth can reach so many more of our areas that just don't have anything. Maybe they just have one provider. They don't have a cardiologist coming down. They don't have neurology coming down. And we're starting to see a lot more of that. It seems like in hospitals, now we have the ability to do a stroke protocol, and you pull a neurologist up on a screen, and here you go. He's actually seeing the patient right there. He's going through the NIH. He's doing all that. And so this, I think, is really what's going to help reach everybody. It's going to be great. If we can get more APRNs out there, great. But in the meantime, you can reach, I can see somebody all the way across the other side of Oklahoma, and then see somebody in my town, and to be able to have the ability to just make sure that we're covering all areas in all different specialties. Telehealth is definitely the future for sure. And getting the opportunity to encourage our rural facilities to really embrace that and reach out to other hospitals. For instance, like I said about the stroke system, that is just simply reaching out to the larger hospitals in Oklahoma City and Tulsa. They already have that program going. And it was simply AVM is the hospital system I work for, simply them making that connection. And now we have that ability to bring in the neurologist to the bedside in the emergency room. So these kind of things is all about networking, which is the HRSA grant's big about that. We're networking, we're building these relationships. So we're getting the opportunity to really see what's out there and to understand how you go about building those relationships and pulling them into the rural area. So I definitely think that's going to be a big changer for the future of rural health.
I mean, thanks for saying that. I definitely agree with you. And two things that actually get me very excited. This was probably in the past, so around 2020, when Oklahoma expanded Medicaid, which also helps to provide additional coverage. And then 2022, with the Consolidated Appropriations Act that expanded telehealth policies. So like Medicare, Medicaid, now allowing providers to audio conference and, serve those communities that we had to, I won't call them hard to reach, we're just not reaching them the right way. But yeah, definitely I agree with you that telehealth and telemedicine is the future. How about you, Susan? What exciting trends or innovations do you foresee in the future, and how those will help address health equities?
So I definitely agree with everything that Debra just said related to telehealth, telemedicine. But in addition, there's such an opportunity. We're just at the beginning, I think, of this in terms of bringing it into our program, but the use of technology. We do have a technology course for our students at the graduate level, but I think we're in the process of updating that because I see the use of technology, wearable devices, for example, where we can have patients in rural settings, underserved patients that have access to these wearable devices where we can extend our reach as providers in monitoring their health care, monitoring their ability to care for themselves. And we did this as a small study during COVID, where we really could not go into the homes of people. So we distributed wearable devices of all kinds of things, and then they transmitted their data back to us. So we know that was just a feasibility study, but we know it's possible, and it's just going to grow even greater. And if we can do that, it will really utilize the skill set of a CNS to think about the systems that we'll have to integrate and collaborate in the other disciplines, and talking to each other and communicating the findings of what we learned through these devices, and then building additional programs around them that will serve the population. So I see it as very exciting, and I really look to the younger generation of nurses that are coming along who know much more about technology than I do, who are much more comfortable with that, who can teach me a thing or two.
Thank you for that. Thank you for that. So one thing we do as a close-up is we have guests leave questions for the next guest. They don't know who that guest is. And then I also have the current guest recycle that on and leave questions for the next guest. And I'm so glad that I have 4 of you here today. So as a way to close off our conversation for today, I'd like to ask each and every one of you, and I'll start with Meagan first. Next year, Meagan, what would you like to be doing differently than what you're doing today? And you can also, once you're done answering that, you can leave me your question and I'll leave that for the next guest. And you're all going to answer the same question. What would you like to be doing differently than what you're doing today for next year? And this was from Drs. Kenzer and Dr. Bissino.
I hope to be immersed in a clinical rotation, putting my skills that I've learned in the program that far to use. That will be very exciting to actually start seeing patients and to be in a clinical rotation.
Great. Cody, how about you? Thank you so much for that, Meagan.
Oh, goodness. Let's see. So next year, I will also be doing clinicals. I hope that I find the specific aspect of my role that I'm going to do the rest of my career. I've been struggling to find exactly what field I've wanted to specialize in within the clinical nurse specialist role, just because of how broad it is. So I hope next year I really find what piques my interest and that I can just go with it. And then question for the next speaker.
Yes.
Let's see. How do you balance work and life?
Oh, that's a good one. I hope they have the answer to that because I've been looking for an answer to that as well myself. Thank you for that. And Meagan, what was your question going to be?
I would say this is hard. It's like one of the hardest questions to ask another question. Cody had a really good one too.
Okay.
Maybe what is one goal you would like to set to work on for the new upcoming 2025 year?
Okay. Thank you so much for that. And Debra, how about you? What's your answer to the question? What would you like to be doing differently than what you're doing today? And the question you'd like to leave for the next guest?
So I do graduate in May, so I'll have the opportunity to hopefully be in an APRN, a clinical nurse specialist position near the end of next year. But one of the things I do want to make sure I do is my DNP this year, my DNP project was on sepsis. And I've gotten some data back, and we had over a 25% increase at 2 different rural hospitals in improving the accuracy of early sepsis screening. And I think having the success with that project has really fueled a desire to keep that project going, making sure that it extends through my hospital system. Also kind of building on top of that. Now, let's educate the providers now and some of the auxiliary staff. And so I hope that am able to keep that passion going. I do really love sepsis and educating on sepsis. So I hope that I can keep that trend going with the hospital system, bring more awareness. And hopefully the education that I did this year can become something that every year during our health fair that we really hone in on sepsis and sepsis awareness and make that, as much education about we do get as a CODI, let's also teach about sepsis. Yeah. If we're going to prevent that, let's also prevent sepsis. So for me, I really hope that I can build on that, that I can really extend not only my research, but also my education opportunities through that. And so I think my question would be, for the next speaker is if there was any disease process that you could personally develop an education for, which disease process are you most passionate about?
And why? Okay, thank you so much. And congrats on your imminent graduation, and I'm sure you do great in whatever you do because you're so passionate about what you do. But congratulations on all of that, by the way. Last but not the least, Susan, what's your response to the question? What would you like to be doing differently than what you're doing today? And what question would you like to leave behind for the next guest?
Oh, thank you. I think what I'd like to be doing differently is to have more of my time for following up this program with research, because there's so many opportunities and ideas right now that are just needing someone to spearhead the research for it. And that's really what I want to do, because I see these things just lying there that I would like to respond to, and I'd like to be more involved in research as the year unfolds. Not that I don't like teaching. I love teaching, but when you try to balance that plate of teaching and service and research, it's very challenging sometimes, as I'm sure you can relate.
Yeah.
And so part of that is to continue working with the students on their projects or their dissertations, because I'm also passionate about the work that they're doing and my involvement with their work. For like Deborah's, for example, it's such a great project, and it's going to make such a difference in the rural settings, and it can be expanded to other facilities. So I'm really excited about working more closely with students on their projects. And then I guess my question for the future panelists or podcasters would be, what can you do in your profession, in your career, to be open to ideas from outside of Oklahoma, to expand your thinking outside of Oklahoma, to improve health equity in the state? Because I just feel like we get very insulated in what we do here. And I'm a firm believer in reaching out across the country, across the world, and looking at how other people are doing things. How are they doing it? How are they able to achieve this, so that we don't have tunnel vision of this is how we do it here in Oklahoma? Because clearly We have a lot of room to.
Yeah,
We have a lot
grow.
of room to improve. Yeah.
Yeah.
So,
Yeah.
so I'd like
you.
to ask them. Yeah, what are you going to do?
Thank you all so much for joining us on this very impactful episode. We've really had the honor of talking to Dr. Susan Dresser, Cody Bynum, Meagan Wright, and Debra Hawkins, and each of them bringing those unique perspectives to the conversation. We explored Dr. Dresser's leadership in advancing nursing education and research, and then Cody, Meagan, and Debra's journeys as HRSA grant recipients and also future clinical nurse specialists, and their collective commitment to improving healthcare, especially for the underserved populations, which I think is both inspiring and transformative. We also talked a lot about how their work addresses those critical healthcare disparities, especially cardiovascular health, sepsis, and the importance of interdisciplinary collaboration, training the younger generation, getting them involved in research and the transition of research into the community. And I think this is just an important episode that really looked at education, evidence-based practice, and community engagement. As we close, I'm more reminded of the power of purpose and collaboration in driving change, and also the importance of living and dwelling in the community that we are passionate about. And I hope this is the same message you were left with today, our dear listeners. Until next time, remember to stay curious and keep making a difference. And I want to thank you all, our panelists, for joining today. You guys did so well. Thank you, Susan, for bringing the students in. I never done this before, but I thought we all, had enough time to chip in and talk about our work and practice as well. And I thank you, all of you, for being here with me today.
Thank you so much, Mo.
Thank you.
Thank you so much.